Huples Cat. Welcome to How to Survive RSV, both now and in a disaster. RSV is a high probability, low impact event.
What is RSV or bronchiolitis?
RSV is respiratory syncytial virus. It's also more commonly known as bronchiolitis.
RSV is a really common winter virus. Virtually all children under the age of 1 get it.
So what's the issue? RSV has a specific season where it affects people depending on geography. Where I am in Canada, it's mid to late fall, early spring. What's been happening across the planet is RSV's been hitting earlier and staying around later.
RSV season in Florida is usually in winter, but now that a lot of vaccinated people are removing their masks, well, she says it's starting to spread more. So you may need to keep these on hand if you're experiencing RSV symptoms.
So is it just a cold?
Many years ago, we used to describe RSV as the worst runny nose of your life.
RSV stands for respiratory syncytial virus. It comes on like the common cold, but for those over 60 and infants, it can cause lasting health issues.
Here's a question for you. If everybody catches it before the age of 1, or most people, how can you isolate from it? Now, the fall to early spring is the peak incidence of RSV. It can strike at any time in the year. But in the fall, winter and spring, Christmas season for some of us, you might want to isolate people under the age of 2. Really isolate people under the age of 1. If it's peaking where you are, like any airborne infection, you need to wear a mask in public when you go to the stores, or where you're going to be crowded, or specifically if you're going to be in elevators or on transit. RSV is also spread by contact. People touching surfaces of RSV virus on it, and then touching their mouth, eyes, ears, etc. Imagine, if you will, every surface is covered in sticky jam during an RSV outbreak, and you know how not to catch it by contact. But really, should everybody wear a mask all winter?
It's damaging to the lungs. Increased incidence of asthma in children who have gotten RSV, even if they didn't necessarily have a propensity to get that, due to genetics or other things.
And it can lead to COPD in the older population. It's very contagious, so if you think you have it, you want to stay away from people who are vulnerable.
Well, if you have children the age of 2, or if you're sick and elderly, or you have immunological disorder, the answer is yes. But in reality, those target groups need to be either removed from the general population during the season of RSV, or they need to wear a mask. In general, for most of us, just avoiding people who are symptomatic of illness is actually going to protect you from catching RSV, provided you are aware of contact and sticky jam. RSV is fortunately one of those diseases that's only really contagious when the person has symptoms. So if you avoid symptomatic individuals, you're well on the way to being protected from RSV. For most people who've got symptoms, 1 or 2 weeks go by, they're no longer contagious. But for infants, for really young children, they can go 4 weeks after the onset of symptoms, i.e. the symptoms left them 3 weeks ago, and they're still shedding RSV. Avoid babies. In the here and now in 2023, RSV kills a lot of people, mostly ill elderly people. But because of how we treat healthcare and death in Canada and in the Western world, it costs society a huge amount of money to treat people with RSV every year. In a major disaster that's ongoing, healthcare won't be available and the economic cost won't exist. In an ongoing disaster, the truth is the elderly vulnerable population is probably going to die of other issues rather than RSV. Certainly RSV is a factor for the elderly in the here and now, but in SHTF it really won't be. But it will be a factor for new babies and young toddlers. So now, and in a disaster, isolate children under the age of 2, or at least under the age of 1, from contact with anybody outside their immediate family. If their immediate family is in contact with other people from outside their group, specifically during fall, winter and spring, you want to isolate that child from that member of their family for a couple of weeks. It may have to only be a week, but do what you can to isolate and protect. If your child has heart disease or lung disease or asthma is a lung disease, it is really important to isolate them from RSV until the age of 2. After the age of 2, until you become very elderly, RSV really probably won't kill you. Under the age of 2, it probably won't kill you, but it kills enough kids to make it a risk factor. Small one compared to everything else that will be going on in a disaster, but something you can avoid. Be aware that in a disaster, pretty much all of us are going to be malnourished. That's one of the risk factors from getting severe RSV. Try and eat as well as you can, try and eat healthily, and that doesn't mean eating white rice and spam. Usually having a runny nose that's really bad is a very good clue that you've got RSV. But with almost all children by the age of 1 having RSV in North America, why am I making it an issue in a grid down? For a few of these children in the now, it means death. Most of them have a congenital illness, but not all of them. In an ongoing disaster, really protect young babies and young infants from outside contact. Let them catch the diseases when they're strong enough not to get severe complications of them. That means about the age of 1, preferably the age of 2. But in an ongoing disaster, there's going to be no healthcare in a formal way. So if you have vulnerable adults, isolate them like you will the children, the infants. Also remember that in an ongoing disaster, almost everybody's going to be immunocompromised because of stress and because of endurance activities they're not used to, and also because of malnutrition. And likely because of grief. All of these things will make you more likely to get infected, and having been infected, more likely to die from the infection. The list of who's at risk in an ongoing disaster will be very different from this list. A lot of people who require cardiac medications and respiratory support will succumb to their illnesses rather than to RSV. The lack of medications will kill off a large number of the vulnerable from RSV. For that reason, I'm going to focus on babies and infants, because the adult population who are at risk from death from RSV is going to be very small. When I was training as a nurse, I was told some wise words during my pediatric orientation. Babies and small children are not tiny adults. They're actually almost a different species in terms of healthcare requirement. The younger the child is, the more likely their presentation of symptoms will be very different from what we'd expect to see. If the baby becomes irritable, isn't as active as they usually are, and is much more reluctant with feed, think RSV. Start to do temperatures, start to rest, try to figure out how you're going to hydrate them. And of course, any breathing difficulties is a big clue something bad is going on. In SHTF, you are the hospital.
While respiratory syncytial virus, known as RSV, is often thought of as a childhood issue, experts say many overlook its impact on adults. The CDC is reporting the RSV hospitalization rate for seniors is 10 times higher than usual for this point in the season. Dr. Julia Paff at Bayfront Health St. Petersburg says to watch out for more severe symptoms.
So if you're getting high fever and dehydration, those are two big reasons for hospitalization for some patients.
RSV doesn't typically send as many adults to the hospital as children, but if it does, it can be deadly for those with underlying health conditions.
So isolate anybody with symptoms from everybody else, and specifically from young infants, for 1 to 2 weeks, preferably for 4 weeks if the infected person was a child, a young child. General full recovery isn't just likely, it's almost definite for almost everybody that will have RSV. However, when you have the symptoms of RSV, you should try and do the following. Rest as much as possible. Isolate from everybody else by using a mask on the person who's infected and the mask on the people treating them, and also washing your hands very carefully before and after exposure to the patient or any surface in the person's area who's got the symptoms. You can treat with small amounts of Tylenol or Advil appropriate for the age of the child or for the adult. What you'll never ever do is ever give aspirin to an infant or a baby. It's a huge no-no, absolutely. No aspirin to a baby or an infant for any reason. You're going to try and do some positioning changes to try and make sure the lungs are able to empty using gravity. I'm not going to get into that in this video, it's quite complex, but if you have a small infant or a small baby, I suggest you get a pediatric textbook for nurses and have a good read of it. What you're trying to do is to try to stop the RSV, allowing them to develop a bacterial pneumonia on top of the RSV. That's a really bad scenario. Obviously stop smoking, obviously don't smoke around them. But in a disaster, think about wood smoke, fires. How do you heat your water? How do you heat your house? Is it possible to keep the child warm and rested in an area that isn't full of smoke? No matter who has RSV, whether it's a baby or me, after 1 to 2 weeks of having a bad cold and feeling awful, we should be fine. If you don't recover fairly quickly from RSV, go to see a doctor, go to an emergency department. If there's any breathing difficulties or if the oximeter is low, take them to an emergency department. Parents need to go to the emergency department of a pediatric hospital. In a disaster, you are the hospital. So do your best.
Wash your hands, stay home if you're sick, clean hard surfaces, and certainly don't go around those that are vulnerable or at risk for more severe illness if you're feeling like you're having any symptoms.
Dr. Paff says most people who get RSV will experience mild symptoms and it will go away in a week or two with what's called supportive care. That's drinking plenty of fluids and getting plenty of rest.
Now I'm pushing isolation and general contact precautions because it's a good way of stopping the spread of any infection, and in fact it can stop the spread of RSV. But the truth of RSV, it's a really great virus that's spreading around between people, and no matter what you do to isolate, unless you're very lucky and careful, probably everybody's going to get it by the time they're 1 year of age. In an ongoing disaster, that will not be true. People won't be moving around as much as they do now, and the chances are that you might entirely have a population in your area after a few years that's never had RSV for a few years, and somebody walks into the area selling stuff or just travelling through, and everybody's going to catch RSV. Be very aware of the fact in grid down it's an ongoing situation. You need to mask, wash your hands, and stay away from strangers for at least 1 to 2 weeks after you meet them. It's hard to know how many people actually get RSV every year in North America because tracking's not great compared to the pandemic virus where the tracking was sort of okay.
Tracking RSV is nowhere near as thorough as it is for COVID-19, so it's difficult to know exact numbers. But those with weakened immune systems and chronic heart or lung disease need to be extra careful.
What we do know from studies is that pretty much every child will have had RSV before the age of 1. We also know that almost all adults don't present with RSV to an emerge or a family physician. They just have it, deal with it in bed for a few days, and then they go on the way. After the age of 2, pretty much that's the same for the child. You're not going to see hyper temperatures, you're not going to see huge breathing difficulties. They're going to have a cold and a runny nose, and they're going to feel like garbage for a few days, and then they'll be fine. Generalized treatment, isolate, hydrate, and give Tylenol or Advil in small amounts to make them feel better and more comfortable. For a lot of people, antibiotics have become a fashionable accessory for prepping, and people are intending to give antibiotics for almost anything without really understanding what an antibiotic is, or which ones treat what, or what the side effects are, or even what the contraindications to giving them are. For RSV, you do not use antibiotics at all unless you develop a bacterial pneumonia. Bacterial pneumonia is an entirely separate topic, but basically, if the sputum, if the phlegm is green, grey, black smells, you should consider that they have a bacterial infection and you might want to start an antibiotic. Giving an antibiotic is a risk. It can cause lots of problems and it can cause lots of side effects, including skin peeling off and death. You don't just give antibiotics easily or fast. If you have a small infant that's having serious difficulty breathing and has definitely got signs of bacterial infection, you might want to consider antibiotics if you have them available. Antibiotics will do absolutely nothing to treat RSV. Otitis Media, young children get this quite a bit anyway. In addition to having RSV, they do actually get Otitis Media. Very painful throbbing in one of the ears, usually not both ears. So how do you treat Otitis Media? Rest, isolate, hope they get better. I don't recommend you treat people with antibiotics, I recommend you go to a doctor, but if you are going to do so for Otitis Media, you might want to think about how to treat it and what with. What you want to give is 80 to 90 milligrams per kilogram for 1 to 2 to 3 days maximum if the pain is severe and if they're not penicillin allergic. You won't see an improvement until at least day 2, so that's why you give 3 days. On the 3rd day, if things are doing much better, go for another 24 hours and then cancel the dose. In grid down, you have to protect your antibiotic source. If they have the signs and symptoms of bacterial pneumonia, you might want to give amoxicillin. You're going to give 45 milligrams per kilogram twice a day. All these doses are oral, I'm assuming you don't have IV stuff available. And you're going to give this amoxicillin dose for 5 days, not for 4, not for 6, for 5 days. If you have a very fat child, do not give more than 2 grams of amoxicillin per day, ever, to any infant or any child. Now, if they're allergic to penicillin and you know that, or you've given penicillin and they're showing signs of being allergic to penicillin and they get bacterial pneumonia, what are you going to do? Now, there's a whole bunch of different antibiotics out there, so I'm picking ones you probably can get. Clindamycin is the go-to in this case, if they're allergic to penicillin, which means they can't have amoxicillin treatment. Clindamycin, 13 milligrams per kilogram, by mouth, 3 times a day. The maximum dose for a child here is 600 milligrams per day. If they weigh more than that, don't give more than 600 milligrams per day, so the maximum daily dose would be 600 milligrams, so you'd be giving 200 milligrams 3 times a day. That'd be the maximum dose. If they weigh less than that, don't give them the maximum dose trying to help them. Give them the dosage based on weight, unless they're very fat. Now again, clindamycin is an interesting one. In the here and now, that course goes for 7 days and then you hope you've recovered. But what paediatricians are now doing is if after 3 days of clindamycin, the bacterial pneumonia has really improved, the breathing's a lot better, they actually stop on day 3. So that's actually perfectly acceptable in now, so you might want to do that in grid down. You're not going to be worried too much in grid down of antibiotic resistance, you're going to be worried about dying. Now if influenza is also circulating with RSV, you might want to treat it with levofloxacin. This is 10 milligrams per kilogram orally, twice a day. If they're under 5, 375 milligrams is the maximum daily dose of levofloxacin. If they're over the age of 5, the maximum daily dose is 750 milligrams of floxacin. Now use your brains here. If you have a very, very tiny child who's 7 but very small, don't go above 375 milligrams a day. If you have a very big 4-year-old, you might want to give them 400 milligrams a day. You might want to give them that. You don't want to go to the 750 milligrams. If they're very fat, give them the lower dose. If they're very thin, give them the smaller dose. Isolate them all. Isolate everybody who's in contact with them, even if the symptoms and the illness is mild. In grid down, you don't have the energy or the expertise to deal with the symptoms becoming severe. Okay, so the good news is if you had RSV, you'll never get it again. No. The problem with RSV is that for children and adults, they can in fact get reinfected with RSV numerous times during their lives. Now, both for children and for adults, the reinfection tends to never be as severe as the first infection. So if you survive the first infection, you're probably going to be fine. The problem is for the elderly vulnerable population. If they get RSV again, they tend to get it much more severely than the first time. Again, in an ongoing disaster, there won't be a large group of vulnerable elderly around. Is it RSV or flu? Somewhat of an irrelevant question because you'll treat them pretty much identically. In an ongoing disaster, in general, it won't matter. You're going to treat with rest, fluids, isolation, and antibiotics if they have a bacterial infection on top of it.
So when you have the flu, you experience body aches, fatigue, and a cough. People with RSV could also experience wheezing and trouble breathing along with that cough. RSV patients tend to have a loss of appetite as well.
Generally, C19 will have diarrhea and vomiting and loss of taste and smell. Generally speaking, RSV won't. RSV often will have sneezing and wheezing and a runny nose, but not always, especially if they're a baby. A pulse ox, or what's formerly called a pulse oximeter, is actually a really good piece of kit to have, both now and in grid down, along with a really good thermometer that's going to work in grid down. Now, electronics might not function depending on what the disaster is, but the chances are if you pack it right, it'll work. An oximeter is a good tool.
This is a pediatric pulse oximeter. It's smaller because their fingers are smaller. And this is the adult size pulse oximeter because our fingers are better. So you put it in, it's going to tell you your heart rate as well. So that's useful to know. It just takes a couple seconds to record. So my pulse ox is 98%. That means I'm breathing pretty well.
Huples, I've heard of the Tripledemic. What is it?
Health experts have termed it a tripledemic due to the rise in flu, COVID, and RSV cases. And all three viruses have symptoms that are similar, which can make them a little difficult to tell apart. Yeah, so this is a graphic we have behind us. This was put out by ABC News back in December, showing you just a list of the type of symptoms you can have with COVID, RSV, flu. Is there anything that sticks out in your medical opinion about something that may be more severe for one versus the other?
Sure. So the big thing would be, you can see a lot of these are very similar to each other, but you can see a few where you can really pick out the symptom that might tell you what you have. We all know about COVID now. If you lose your sense of smell, as you can see there, that basically
it's rare
right there, and that's going to be a really great indicator that you probably have COVID if you've lost your sense of smell. Now, what's going on a lot that have parents concerned, of course, is RSV. How do I know if my kid has RSV? And you'll see there down at the bottom here with the wheezing, that's something that if your child starts to wheeze, that is something that should bring a little bit more concern to you if you're a parent.
Now, how quickly can these symptoms come about? Do you see it quicker maybe if you have the flu versus if you have COVID? May it take a few more days to start seeing symptoms?
Yeah, so that onset of symptoms up here. So influenza tends to come on a little quicker, but you know, that's just a general rule of thumb. But generally, you kind of feel COVID coming on a little more gradually. Same with our RSV, but flu does have that distinguishing characteristic of you're fine one day and then suddenly the next you're put up.
Which of the three diseases worst for which age group?
So RSV, always worry about it for kids that are less than 6 months old or have some sort of prematurity or some other condition. But as adults, you know, we get RSV all the time. Now, as adults, what you worry about, if you're less than the age of 65 and healthy, honestly, really shouldn't worry about any of these in terms of mortality. But once you start crossing over the age of 65, start accumulating a little bit more medical conditions, most commonly being bad things with your lungs, your heart, that's when you begin to worry a little bit more about COVID-19.
Vaccines for RSV are new and are being pushed to the point of shortage. Just a word of note, there is no actual vaccine for children and infants. It's a different type of therapy.
A vaccine 50 years in the making. Doctors say this shot will save lives.
It will be a game changer in significantly preventing severe illness and death, especially amongst older Canadians.
Approved in the U.S. in May, this is the first vaccine for RSV, or respiratory syncytial virus, for people over 60.
I think it's a big deal.
In a large trial published in the New England Journal of Medicine, one dose of the vaccine showed nearly 83% efficacy in preventing RSV lung infections compared to placebo, and 94% efficacy in protecting against severe RSV-related disease.
Every winter in hospitals across Canada, we're admitting individuals, usually seniors, with RSV infections that have severe infection in the lower respiratory tract.
Like the flu virus, RSV starts circulating in late fall. At its worst, it causes bronchiolitis, inflammation of the small airways in the lung, and pneumonia, making it difficult to breathe.
We know that older adults, as well as young children and infants in particular, are more likely to develop nasty complications.
There is no RSV vaccine for children. Earlier this year, Health Canada did approve an antibody injection that can be given to high-risk babies to help protect them from becoming seriously ill. At the same time, other RSV vaccines for seniors are still in the works.
All these treatments are going to be in short supply whenever there's an RSV outbreak, and they won't be available in a disaster. Now, some areas are giving them free, some areas are giving them free to at-risk people, but mostly if you have to pay for it, the vaccine is going to cost you in Canada about $230 Canadian dollars. Now, it's a very high probability that your newborn, now and in disaster, will actually catch RSV. It's actually more likely they'll catch RSV in the first year than not. It's also extremely unlikely to actually kill them. So in a disaster, the main point of RSV is to know how to do isolation for airborne and contact, to know how to treat basically respiratory illness in the neonate, in the young kid. You need to isolate them, and you need to quarantine them away from other people that might infect them. These are the types of skill you need to know now and know well, and also be able to implement in any type of a disaster. Because RSV is a high probability event, but a low outcome event for almost everybody that's going to get it, you need to actually incorporate lifestyle changes now, and definitely in a disaster, to try and mitigate the effects of catching and passing along any infectious disease. If they can, your children know how to wash their hands with soap and clean water, and they need to be able to do it unsupervised and frequently and appropriately. So in a disaster, a good supply of clean water and soap is kind of critical for you to have. If you have infected individuals, you want to isolate them if you can outside of the home for at least a week. If you have children under the age of 2 and if you have newborn infants, you want to isolate them for at least 2 weeks. Now, and in a disaster, you want to have a clean house. Are you able to use a vacuum cleaner? If not, have you figured out how you can use a dustpan? Do you have a dustpan? Do you have decent sweepers? Are you able to spray with water bottles to get rid of dust and then collect it? All the old-fashioned skills in cleaning a house, do you have them? Can you use them? If your plan is Clorox wipes, they're going to run out. As a standard plan for a group in a disaster, you want to make sure every member of the group, including infants, have their own colour-coordinated cutlery, glasses, mugs and plates. Sticking labels on stuff isn't going to work very well and germs can get under the labels. But if I'm using red plates and Kitty's using green plates, it's pretty easy for me not to use Kitty's plate. If anybody has any sort of illness in grade down, they don't cook, they don't do washing, they don't wash up, and they don't do farm activities. Keep them rested, keep them isolated. For children under the age of 2, taking up cigarettes is a bad idea anyway. But as I said, wood smoke is bad for everybody. Do what you can to limit wood smoke. If you have to use a wood fireplace, make sure it's a sealed unit like I have in my house. If you have to use a portable unit, make sure it's something like a BioLite stove that's specifically designed not to put large quantities of wood smoke into the atmosphere. Wood smoke actually is carcinogenic over a period of time, and if the disaster has been caused by a nuclear leak or a nuclear war, a lot of the wood smoke, if you use fresh wood, is going to be highly radioactive. So it's a good idea to think about asthma and RSV. How do I limit my exposure and my children's exposure here and now and in a disaster to smoke? At times is a fun one. The actual risk of RSV transmission to children is from other children. So you should be able to easily wash other children. What I would do, and I had no plans for this, but if I had a newborn in a disaster scenario that was an ongoing one, I wouldn't let anybody near that child until they were at least 2 years of age, other than the immediate family. Anybody in the immediate family who'd been compromised by talking to or close to another person outside that group, I would isolate them from all of the group for a week and hopefully for 2 weeks. Take it seriously. Children easily die in ongoing disasters. In fact, we all easily die in ongoing disasters. Thanks for watching. I hope you're enjoying this series on how to survive anything. I'm not quite sure exactly what I'm going to do for next Fridays. I think I might be doing bird flu, though I'm getting a bit repetition on infection. So I might branch out a little bit and start talking about physical injury or radiation. Let's get into some interesting things. Let's dialogue in the comments. Please share this, please like it, please give me a thumbs up, it validates me. And whatever you do, take science seriously. Understand and have knowledge of science. It's as critical to you now and in a disaster as how to make a fire without a Bic. Something I'm really hopeful I prepared never to have to do. Doodles! This has been a Wolfie Terrier 2023 production. Wolfie thanks you for watching, and if you could exit quietly so you don't disturb him, he would appreciate it. This is a Hungry Cat production 2022. Treats! Treats! This is a Hungry Cat production 2022. Closely observed by Hungry Terrier production.